Danielle, one of the prolotherapists at Caring Medical, and I'm going to talk to you today about ischial tuberosity pain, or butt pain, as a lot of people call it. So in order to explain this, we're just going to go over a couple of crucial anatomy things. So this here is the human pelvis. So this is the front, like where your pubis is. These are like your hip sockets. And then if we kind of flip it around, this is your tailbone, like your sacroiliac joints of your low back. And then these right here, these kind of bony prominences are your ischial tuberosities. So these are actually like what you sit on when you sit in a chair. People that kind of have, like, what they say is, I have a pain in my butt, oftentimes will have pain at this ischial tuberosity area. And they might say, oh, I had just tight hamstrings, I stretch them out all the time, or I foam roll like crazy, or I've done cortisone shots, things like that, but this pain keeps coming back. And so there might be a couple of different reasons why that is. So sometimes patients will come in and they truly have like a hamstring issue. Your hamstring tendons attach here at this ischial tuberosity. If you have a tear or degeneration, it's going to hurt when you put your whole body weight on it to sit down. Sometimes, however, patients will come in with a chronic ischial tuberosity pain that doesn't get better with anything they've tried because the pain is coming from elsewhere. So if we think about it, kind of back to this anatomy, like you've got your sacroiliac joints here, right? Kind of big stabilizers of your pelvis. And you have these connective tissues that go down to that ischial tuberosity. So you could actually have like a sacroiliac instability that moves this bone up and down that tugs on your hamstring. You could do all the hamstring treatment in the world. It's not going to get to the root cause if it's an underlying sacroiliac issue, which is actually more common than you would think. The other thing is, especially in runners that have like a hamstring issue, or maybe they say, oh, I pull my hamstring all the time, and then I rest, and then I pull it again. Well, likely, if you're doing treatments at the hamstring and it's not working, we got to evaluate your hip. Because a lot of runners, again, if we think about it, like here's your hip socket, here's your ischial tuberosity. I mean, they could not be closer. And if you have a hip issue like a labral tear or an instability, it's going to cause you to use more force of your hamstring, activate that more, which might actually be causing pain like in your butt. Part of the workup when people come here for a chronic like butt pain or hamstring issue or ischial tuberosity issue is we have to look at all these areas. Is it solely your hamstring and its attachments? Is it your back? Is it your hip? Is it a combination of all of those? Because getting to that root cause is what's going to help you get better. And again, like I said, common in runners to actually have a subtle hip issue that maybe the average human wouldn't notice, but they are marathon runners. They put a lot of pressure on their body, so any kind of subtle instability would be more prominent to them. Most treatment plans for something like this do involve like routine treatments. Again, you've had this issue maybe for a while and it's degenerating. You've got this degenerating condition. We've got to stop it and reverse it. We've got to stop the degeneration and get these tissues to regenerate and be strong. So it does take several treatments in order to do that. The average person maybe between 4 and 6, and that could involve dextrose prolotherapy or even using cells from yourself, like drawing some blood, concentrating the growth factors out of it, which is called PRP or platelet-rich plasma. And that just depends on the severity of the case, the patient, their activity level, and so forth. So that's something that's decided when you're here in the office.